Kwani wewe ni mjinga kiasi gani? You know? And number two, even if you sign for whatever equipment, it is you to choose what equipment you need. And if you have alternative ways of getting that equipment, you are free to get those alternative equipments from wherever. The only thing we were doing is to... I want to assure the country that the challenges of fraud and corruption that had bedeviled the NHIF, they will never be, as so long as I am in charge, they will never be in our universal health coverage plan. We have costed the equipments, we have costed the drugs, we have costed the services with experts, the procurement of any equipment, the one that I see people talking about in the media. There was a procurement process. It was carried out between the counties and the national and the Ministry of Health. There is no obligation on any county to get any equipment from any supplier. There is no one supplier. I think there are 7 or so suppliers. And there is no obligation on any county. Anybody who says they were forced by the national government to sign whatever contract, those are conmen and they are liars. Because Mungaro is here, Abdul Samad is here, Fatuma is here. They are governors. There is nobody who forced them to sign any contract. That is the truth. Nobody was forced. And nobody, you have to be a fool to be forced to sign the wrong thing. And you actually sign. You know, and you go and announce that I was forced. Kwani wewe ni mjinga kiasi gani? You know? And number two, even if you sign for whatever equipment, it is you to choose what equipment you need. And if you have alternative ways of getting that equipment, you are free to get those alternative equipments from wherever. The only thing we were doing is to... these are the county governments. That's the truth. Sindio Mungaro. That's correct. So let us not, and I am here and I will look the people of Kenya in the eye and tell them there will be no corruption in social health as so long as I'm president. You know? And I am willing to be challenged, because we must get rid of corruption. We must get rid of fraud. We must make sure that Kenyans get the benefit and value for every cent they spend on everything, including in matters health. So that is how we're going to do it. It's going to be a commitment that we are going to make, all of us. I have asked all our counties and even the private sector. The program we have is going to make sure that citizens can pay for services, but those services must be provided. That is why there is need to have equipment in our hospitals. That is why there is need to have medicine in our facilities. And that is why there is necessity to have the human capital in terms of health professionals to provide that service. And we are working with the counties to make sure that wherever we can assist as a national government, let me say this, we've just released 2 days ago 1.5 billion shillings to assist KEMSA to make sure that they work with the counties to access drugs. I have asked my friends in the county governments to also pay their part to KEMSA so that we can get drugs, so that when citizens go to look for health service, there is money to pay from SHA, but there must also be drugs, human capital to dispense, and also equipment to make sure that that service is provided. So we need a healthy population for us to drive our country into the next level.